Have you ever wondered what people in the medieval era thought was responsible for mental illnesses? Well, let's explore some of the medical theories like the stone of madness and excessive black bile today in this video. As a GP or family physician, I manage many patients with mental health illnesses, and it seems that our understanding and management of mental health is very different to that back in the medieval times. So if you want to learn more and enjoy exploring how medicine has evolved through the ages, then please follow my channel, Doctor of the Ages. So during the medieval period, there was lots of theories about what caused mental illnesses, ranging from physical imbalances in the body to supernatural forces. The stone of madness was an interesting theory, and it was based on the understanding that a physical object or stone within the body was interfering with the proper functioning of the mind. People in the medieval period had limited understanding of the brain's structure and function, and so they usually looked for any sort of tangible explanations, and these usually involved invoking physical objects to explain changes in mental state. It was believed that the stone could form in the brain or other parts of the body and obstruct the flow of the body's humours to cause mental disturbance. It was widely accepted that the body had 4 humours, including blood, phlegm, yellow bile and black bile. Mental illness was often associated with an excess of black bile. Let's look at a quote for Arnaldus de Villanova, who was a 13th century physician. He said, "The stone that causes madness lies within the mind, for it is the excess of black bile that hardens into a dense substance. When the humour thickens and transforms, it may appear as a stone, either in the body or in the mind, leading to confusion and erratic thoughts." And that basically sums up medical theories of that time. So let's look at some of the mental health conditions that were thought to be caused or potentially linked to the stone of madness and excess bile. Depression or melancholy was thought to be linked to an excess of black bile, but it was also believed that this condition was caused or worsened by the presence of a stone in the brain, which caused heavy, oppressive feelings and an inability to think rationally. Extreme sadness and suicidal thoughts were thought to be symptoms of the stone's influence as well. Other conditions like dementia, hysteria and psychotic behaviour was linked to the stone of madness as well. They thought it caused a physical obstruction that prevented normal cognitive function, as well as an excess of black bile. There were various theories about how the stone could be removed or treated. Some medieval treatments included surgical procedures or trepanation, and this involved boring a hole into the skull in an attempt to release or remove the stone. It was believed that by opening the skull, the physician could either remove the stone or allow the release of excess humours or fluids that were contributing to the mental illness. Drilling a hole into the skull is not a common surgical procedure these days, and it's only used to manage certain conditions like brain tumours or subdural hematomas. It certainly is not a procedure used to treat mental illnesses. Most patients that had this procedure in the medieval era would likely suffer serious consequences such as infection, brain damage during the procedure, significant blood loss and even death. Apparently there were a select few whose mental health did improve after the procedure, but this, in my opinion, was likely due to it being caused by an underlying physical health condition which was increasing intracranial pressure. So in that case, you would get some relief when this pressure was reduced, but this was very rare. Other treatments like bloodletting or purging were used to try and restore balance of humours and get rid of excess black bile. It is known that neither of these would improve patients' mental health and likely do more harm than good. Bloodletting would often cause patients to become anemic, and purging would cause issues like dehydration or electrolyte imbalance. Psychiatric hospitals did somewhat exist at that time. They were nothing like the modern institutions that we are familiar with today. At that time, they were typically founded by religious orders and focused on care via religious rituals like exorcisms or prayers to rid the mind from demonic possession, sin or punishment from God, as these were factors commonly thought to cause mental illnesses. In some cases, patients might be offered simple medical care, food and shelter, but in other more severe cases, the mentally ill were housed in chains or cages to prevent them from harming themselves or others. So although these early institutions were important in the history of mental health care, it was centuries before more modern and humane approaches developed. The modern understanding of mental health has disregarded the theories of that time, and we would now treat patients with different forms of counselling and evidence-based medication depending on the condition we were managing. For patients with severe mental illnesses, different levels of specialised psychiatric hospitals are available to provide a safe environment and 24-hour care by trained psychiatric professionals. So this area of medicine has developed tremendously. If you enjoyed this video and want to see similar content, please do follow my channel, Doctor of the Ages. Thank you.